Well, tonight in our series, Coronavirus, 1 year later, a closer look at saving the lives of people who get very sick. According to researchers at Johns Hopkins University, 1.7% of people who have been infected with COVID in the U.S. have actually died from the virus. Here in Massachusetts, more than 14,000 people have lost their lives with COVID-19 over the past year. More than half of them, about 7,600, had been hospitalized, and more than half had pre-existing conditions. We want to bring in our Dr. Mallika Marshall now. Thank you for joining us, doctor. And we have been in this fight now for almost exactly a year. Do you think we're getting better at saving patients' lives?
Yes, we are, and death rates are falling, probably for a couple of reasons. First of all, the people who are getting sick now tend to be young people, and they're much less likely to get really sick from COVID-19. Plus, we've learned a lot over the past year, not only on how to try to keep people out of the hospital, but also how to treat them once they enter the hospital.
And so let's talk a little bit more about that, Mallika, the things that you can do to try to keep a patient out of the hospital. What's working?
So primarily, we want to talk about monoclonal antibodies, and those are designed to attack the coronavirus itself. They can be given to patients with mild to moderate symptoms who are at high risk of developing severe COVID-19, people with obesity or diabetes, for example. Studies have shown that monoclonal antibodies can help keep people out of the hospital. Now, there has been some concern because with some of these recent variants, it appears that the antibodies are less capable of keeping those variants at bay. So companies are really trying hard to create sort of super antibodies so that the coronavirus, even with genetic mutations, won't be able to evade them. Now, these antibodies are usually given in a single infusion, but through an IV, which means you usually have to be in a clinic or a hospital to get them, although we're trying to now make it available to patients in their homes so that, again, they can stay out of the hospital.
Which would be great. You really want to keep people out of the hospital if you can. If someone does need to be hospitalized, what can be done then?
So the big goal is to try to keep people off ventilators, because once someone with COVID-19 goes on a ventilator, it's very difficult to wean them off. So patients are given supplemental oxygen. They're encouraged to lay on their stomachs, a strategy called proning, which can open up the lungs and make it easier for them to breathe. They can be given medications like steroids, such as dexamethasone, which it can suppress inflammation in the lungs and has been shown to reduce mortality. They can use antiviral medications like remdesivir, which if given in the first few days of symptom onset can actually speed recovery. And then people with COVID-19 are at higher risk of developing blood clots, so a lot of patients are put on blood thinners.
And the best advice is probably the most simple advice, which is don't get sick in the first place. What's your best advice on preventing infection?
So wash your hands, wear your masks, keep social distancing, get vaccinated as soon as you possibly can, and then all those things you want to do to reduce your risk of infection in the first place. Getting good sleep, exercising regularly, eating a healthy diet. There's also some evidence that vitamin D supplements might reduce your risk of getting respiratory infections in general, including the coronavirus. Studies are underway now to see if giving vitamin D to patients with COVID-19 might speed their recovery. I don't think it's unreasonable for most people out there to take a daily vitamin D supplement, but of course, before you do that, you want to talk with your own physician.
All right, Dr. Mallika Marshall, as always, we thank you so much for your expertise. Tomorrow, Dr. Mallika discusses the lasting effects that some of the sickest patients are experiencing. Then on Friday, a look at what's next in the fight against COVID-19 and when we could see a return to some sort of normalcy, something, Lisa, we are all looking forward to.
Can't happen soon enough. David, doctor, thank you.